I think the most valuable experiences that I've had here that have prepared me for my future practice in clinical medicine would have to be the amount of procedures that we get to experience and also the one-on-one attention that we get with faculty and preceptors. So a unique thing about our clinic is that we do what's called a procedure clinic, where on a certain rotation, all you do all day is see procedures, and you do everything from vasectomies to biopsies to joint injections, which is really important for me because I'm interested in doing sports medicine potentially. And when I'm on my rotation with Dr. Wong and Dr. Mongold, two of our sports medicine faculty, it's just phenomenal to be able to just be you and the preceptor going through clinic, and whenever a procedure comes up or a teaching point, it's just the two of you, and so it makes for a very valuable learning experience.
So our program here at IU Arnett, I feel prepared me very well for my future practice. And the reason why I say that is because starting from day one, you really get the hands-on exposure to how do you manage your patients. So from day one, these are your patients in your panel. You see them from the beginning of the visit. You put in orders. You actually follow them to the results. You respond to the messages. So you get that whole spectrum of actually catering and serving your patients from day one. And that's what it's like outpatient. So you really get that exposure. Not only that, we have a wide spectrum of learning. We have awesome peds experience, awesome inpatient experience, awesome ortho experience, sports medicine experience. So you really get to have a hand in every part of family medicine, which is what our field's about. So you really can actually have a practice where you can either pick one thing you do, clinic for example, or you can have a broad spectrum of things like OB and sports medicine and clinic as well. So you really get exposure to everything. Not only that, for me personally, I love procedures. We have an amazing procedure clinic here that's very much in demand. We get referral patients from across the entire FM program. So we really have a lot of patients that want biopsies, skin tag removal, things of that nature. So we really get hands-on exposure, and I think that will prepare me very well for my future practice.
I think this residency has definitely prepared me for the future. Particularly with myself, I'm interested in geriatrics, and from the very start, the program has tailored my experience to preparing me for that. For example, we take care of patients in nursing homes, and I have been able to reach out to our local geriatrician, who is definitely involved in the community in tailoring certain electives and certain additional curricular activities to learn that community and to be able to serve them. Additionally, we are able to do a wide variety of care in our clinic, including OB care. And we do deliver our own patients, and we take care of their kids, which is very rewarding. And we take care of 4-day-olds up to almost 102, one of our patients. So we have a wide spectrum, and I think in particular our longitudinal curriculum is very unique, and it allows you to see a lot of variety of different fields, including cardiology, as far as working on inpatient versus outpatient, in addition to orthopedics and sports medicine, which really allows you to feel comfortable with injections and using the ultrasound machine. Furthermore, you get to work with the gynecology and do different types of procedures in addition to dermatology. So seeing that wide variety of different fields early on in our longitudinal curriculum really prepares you for your own clinic early on. And I would say as a third year, I'm definitely looking forward to my future potentially in geriatrics, but also with taking care of patients in an outpatient setting, and I feel very prepared with the curriculum that our program has set up.